Good evening, everyone, and welcome to this session on prostate cancer. This session is organized between the Watford African Caribbean Association and Watford Borough Council. And thank you, Sharon, who is on the call for um, working with us to organize this session. As I say, my name is Clive Saunders. I'm the chair of the Watford African Caribbean Association. And I'll probably say bits and pieces about that as we go along. Um, it's an organization that's been around for near 50 years. And we believe, well, we don't believe, our reason for being is to focus particularly on the health, well-being, welfare, culture, and so on, particularly of people of African heritage. So welcome, everyone. You're not going to hear too much from me in the main because we have people who know a lot more about the subject who will be talking to you than I do. So welcome particularly those guests. We have Peter Ellis from Prostate Cancer UK, who is going to be our main presenter this evening, and I know he's got supporting him, Tyler, who's also from that organization. Um, Peter is going to speak to you first in a moment, and then he's going to be followed by Danny McKenzie, who is going to share some of his lived experiences with you as go through the evening. It's always a pleasure, of course, to have Dr. Pearl with us, who is our resident GP member of the organization, who will particularly be here to answer some of the questions that may be relevant for her. But this really is going to be a session about all of us and us sharing our knowledge and experiences. Um, and at the end of the day, hopefully creating an environment where this particular disease doesn't cause any more havoc than it's already causing. But we also have with us, I should say, Michael from Cancel Out Cancer UK, and they're here. He's here really to say a brief word, and we'll put that in the agenda later on about that organization and how we might engage with them. So welcome, Michael, and welcome to you all that are with us this evening. That's probably enough from me for now. We've got some of our members who will be helping me co-host as usual. Marilyn, I see you, so I'm going to make sure you're co-host to help me as you usually do in that way in which it's only you can do. So, okay, so I'm going to ask now Peter Ellis to um, share a presentation with us to kick us off. Peter, welcome, and maybe you'd like to tell us something about yourself and then just make your presentation. Peter.
Good evening, everyone. My name's Peter Ellis. I am a volunteer for Prostate Cancer UK. I've been a volunteer now for the last just over 5 years. I was diagnosed with prostate cancer in May of 2018, and I went on to have a prostatectomy, radiotherapy, and um, there is more to come as well. So I've lived the experience. I've and in my spare time, I make a point of talking to men as much as I can about this. So that's me. I One of the things that I did out of it is I created a blog, a podcast, and yeah, I just talk whenever I get the opportunity. So I'll just go through. I've got a presentation. So let me just share my screen and let me know when you can see that.
Yes, we can see it. We can see all of your screen at the moment.
Okay, I'll just get this onto. Okay, can you just see the presentation now?
Yes, we can now just see the
Oh,
presentation.
okay, right. So this is understanding prostate cancer and your risk. I've spoken a little bit about me, and so to start off from the very top, what is a prostate? It's a small walnut-sized gland. It's used to make semen. Only men have one, and it carries sperm during ejaculation. It's situated just underneath the bladder, and the urethra runs through it, and that's important. That's important when we talk about it later. And who this affects is generally men over 50, but if there is a history in the family, it's something that you want to be looking at from about 40, 45. So what conditions affect the prostate? You've got an enlarged prostate. So this is where it's just like any other organ in the body. It gets enlarged. And as it gets enlarged, the urethra that runs through it is constricted. And what that leads to is many of the conditions that men experience, such as a slow flow, a regular flow, so you need to pee more than often, or you have trouble starting to pee. Those are conditions of an enlarged prostate. And we know that King Charles, he's just been diagnosed with an enlarged prostate. You've got prostatitis, which is the inflammation of the prostate, and that's a bacterial inflammation. So that's normally cured by tablets, medicine, and then ultimately you have prostate cancer. So it's the most common cancer in men. It affects 1 in 8 men, or should I say 1 in 8 white men. 52,000 men are diagnosed every year with this. And of that 52,000, about 10,000 are diagnosed late, i.e., as I'm going to come up when I start talking about symptoms, these are men who may have experienced some of the effects, but didn't do anything, or men that had no symptoms at all and didn't realize until it got to a stage where there were symptoms, or perhaps they just went for a test. Most men diagnosed with early prostate cancer can be successfully treated. One of the main things about this is getting ahead of it as opposed to it getting ahead of you. And early diagnosis means that there's a lot more treatment options. But for most men in the early stage of prostate cancer, there's very often no symptoms. And with all my colleagues at Prostate Cancer UK, there's only of the volunteers, there's only 2 guys that have mentioned any symptoms. One of them, he was peeing blood for a few months before he did anything about it, and another one had problems with their flow. But other than that, it's one of these things that generally there's no symptoms. And it's vital for men that are at risk, and I'm going to come to some of the risk factors, that they speak to their doctors before any symptoms are detected or experienced. It's about, as I said just earlier, it's about getting ahead of this condition. So who's at risk? Men aged 50 or over, and your risk increases as you get older. The higher risk category are black men. So at the beginning I said it was 1 in 8 for white men. For black men, it's 1 in 4. Also, there's an increased risk for men with a family history of prostate cancer. Prostate Cancer UK, they have a risk checker, so you can scan on the QR code at the bottom there, and by answering a few simple questions, it can tell you what kind of risk that you're currently at, and I can show that again later as well if you want. Any questions so far?
I have a quick question. Well, if you're asking, I'm just curious to know, why is it 1 in 8 white men and 1 in 4 black men? Is that something to do with genetics, or is it something to do with lifestyle, diet, economic factors? Can you say any more about that?
We don't know.
Okay.
We don't know. What I can tell you is it's 1 in 6 for Irishmen, which was a statistic that it's not widely known, and it was quite surprising. But we don't actually know why.
Pete, question for me too, Peter. Just as you, so do we know, is there in some of these areas of diseases that impacts on us, it seems like there was some commonality between people from the tropics and including Asia and people of African origin. Do we know if there are any similar figures around the Asian population?
So in a presentation that fuller presentation that I do, what I can tell you is the 2 countries that have the highest prevalence of prostate cancer are Guadeloupe and what is it? Is it Martinique? Martinique and Guadeloupe.
French-speaking islands.
Yeah, and the reason is because of a pesticide that was used in the 70s. And it's called that pesticide's called Kipone, and it was only discontinued in early 1980s, and it's in the water table, it's in the it's all over the food, and those 2 countries have the highest prevalence because of this particular pesticide. So those are the only statistics I can give you that are well documented.
One further question from you, Peter. You said earlier on that your risk increases with age. So are you saying the older you get, the more likely you are to get it? So that, for example, although it is 1 in 4 black men are likely to get it, does that mean once you get to be, say, 80, you're 1 in 3, or so does it increase in that kind of way?
Well, what happens is, depending on your age, there's a certain threshold. So when I reached 50, my threshold was 3.5, and as I get older, that threshold would come down. So somebody who is 55, their threshold, for example, may be 3. And I know those figures, they've been revised since. So just as you get older, they're looking for a particular threshold. And my PSA at the beginning was, I think, 6.5. So straight away there was a problem. But it's all about, it's at a particular age, there is a particular threshold. But if there is the family connection, then that's something you need to look at earlier as well.
Can I come in there?
Yep.
Yes, hello. Yes, so my name is Dr. Onyekuru. So thank you so much, for that. And like you said, I'm not sure that we know all of the figures, but we do know as men do get older, the likelihood of getting prostate cancer does increase. However, just like you say, it's also as the numbers, as a man gets older and we do the PSAs are checked, it's not also just about the PSA number. It's about the risk of spread. It's about the rate of spread. It's about the what we call the expected life outcome. So, so if a man is in his 80s or might be much older than that, and you think, well, what is his 10-year? We then think about his 10-year lifespan, and what is the risk of treatment? The risk of the disease spreading over the next 10 years, or the mortality figure over the next 10 years. And so those become some of the calculations that are put into some of the numbers, and how the PSA then not just is checked, but also and how the disease itself is followed and monitored. So I'm not quite sure of the full details, but we know that as men get older, that their risk does get higher. But also, you're not just looking at the disease; you're looking at the life expectancy, you're looking at the outcome, you're looking at how well or unwell that gentleman is, and what the effect of treatment would have on that gentleman. And so those become some more of the more sort of calculated discussions that will be had with that man, the family, and his oncologist.
Thank you, Dr. Pearl.
Yes, I hope that helps.
Okay, I'll continue. So the main test is the PSA test, the prostate specific antigen test, and it's a blood test. And it's a test that it's a very simple 2-minute blood test, and it's a test that practically every time I have a discussion, I'll get a guy that asks me that or tells me that they've gone for a test and that it's been refused. Now, if you say under 40, then quite rightly you'll probably be refused. But if you're in the risk group or risk groups, it's something that you really want to insist on getting. And I can answer questions about that afterwards. So the other test is a digital rectal examination, and this is the thing that a lot of guys have a lot of problems with. And I'll say it as it is, especially black guys. They have a real problem with this. I've heard every excuse you can think of, ranging from I'm not gay, it will make me gay. I'm not having any man do that to me, and a whole list of issues. And unfortunately, some guys also think it's the main test, and that puts them off from going to inquire about their PSA. But it's only in addition to the PSA test, and like I said, this is one of the hardest sells. But it's something that it's 2 minutes, if that, of discomfort, and what the doctor is trying to find out is if the prostate is enlarged or it's got a hard or a lumpy surface. And the key thing about this, which is why it's not the main test and it's not done on its own, the doctor can only check a small subsection of the prostate, which is why it's used in conjunction with other tests. But like I said, this is the hardest sell for guys. So here's some myths. Prostate cancer is a good cancer to get. And I know where that's come from. That's come from the fact that the cancer, if caught early, is encased within the prostate, unlike many other cancers which are free flown in the body. I mean, no cancer's good, but if it's caught early enough, it's still contained within the prostate. Your GP will not invite you for a test. There is not a national screening program, and there's not likely to be one either. All men are not of the same risk for prostate cancer. I can tell you of a 40-year-old white man that died of prostate cancer, and he didn't have He didn't have a family history of prostate cancer, but he had his sister died of breast cancer, and his mum had breast cancer. So there was a connection from that side. And if you're waiting for symptoms, you could be in for a long way. Generally, if you've got symptoms, it probably means you're worse off. So this isn't something that you wait for symptoms, because generally most men don't have any symptoms. Andrew, you got your hand held up?
Yeah, I have. Hi, how you doing, sir?
Very well, thank you.
Yeah, give thanks for the little earrings. What I was going to ask you, explain to people a bit more, because you see when you say black men don't like having it done right, you know, it's because it's the way it's been told how it's been done. Yeah, because what I'm getting to understand, it's not really a finger directly up your bum like they think. It's not really like that. Yeah, but
It's exactly like that.
No, well, to what I know, because I've had it done, and they didn't do that to me. You know what I mean? And like
it's exactly like that. There's no escaping it. It's, you know,
So, sorry, do you mind if I come in there? Is that okay?
Yeah,
So,
sure.
So, you know, within the past probably 1 year-ish, there has been a drive to improve cancer diagnosis within the NHS, and to screen and sort of capture cancer early, and especially in communities where cancer diagnosis is either much higher or their presentation is later, which is in particular sort of what you can group as the BAME community, and some other communities as well. Now, the current thinking is, yes, you should have part of the assessment of your cancer diagnosis would be a digital rectal examination, but it's not the only thing. And if you are absolutely against it, we say have the blood test first, because ultimately that's really what is going to help distinguish whether there's a need to do anything further or not. But of course, you don't have to have a digital rectal examination anymore. There are a lot more diagnostic tests that can be done to assess or ascertain that positive test. If unfortunately a person does have a high PSA, then there will be other tests that will be done to confirm whether that PSA reflects a cancer or whether it's a benign prostatic hyperplasia. And so those will be things that will be done. So yes, it is part of the test. It doesn't have to be for everybody, but we'd rather say come forward first, get your PSA done, and then then we can take it from there. That would be the next step. So what I'm saying to men is, don't let the thought or the fear of a digital rectal exam or a finger up the bum stop you from having your blood test. We know that it can be a barrier, and we're trying to overcome that.
Is that okay, Andrew?
No, not really. Because let me just say this to you. Yeah? I'm a man. I'm like the typical black man. I don't want none of them things, because my dad died of it. Yeah. So I'm a man. I get to understand, the older generations, they wasn't really up for that. But like I said the same thing. But then I said to myself, well, you know what? I've got to check this out. But I'm saying, when I went to my doctors, yeah, it was a African lady, yeah, and she said to me, it's nothing. It doesn't even hurt. It's nothing. And I thought, right, for real? So I said to her, all right, no worries. And then she said, you sure you want it done? I said, all right then. But the thing, what shocked me, it only took about. She just said to me, lie down on the table, and then she said, just crawl up into a ball, and then within about 10 seconds, 15 seconds, she checked, and I thought, wow, she didn't really do nothing invasion to really how you are explaining it to me. And I mean, that's why I'm getting a bit asking the question, because it wasn't as intrusive to what I thought it was, you know what I mean, to how you're talking it. So I don't know, did she do it wrong then or something? So I'm not sure what's going on there. You know what I mean? Because like, I know there's like because sometimes they say having a blood check doesn't actually tell you the results. It's not conclusive. It's not you know what I mean? It's not directly, you know, you might not get no, you know, signs by having a blood check. So then I said, well, what's the other check? And then they said, I'm going the other way. And then, but I'm just saying, I didn't think it was that intrusive to how you're talking, you know what I mean? So I don't know, you know what I mean? Because it happened so quick, I didn't even know she'd done anything.
Well,
You know what I mean?
well, Andrew, I have to say, good for you, because that is exactly the case. I mean, even when I try and talk about it, I say to men, listen, your wife, your sister, your mum, your partner, they have far more intrusive tests, and you don't hear them belly aching about it. And I say that because that's the audience that I've got. And you know, some guys that like yourself, they just say, well, you know what, it's not a problem, and it really isn't a problem. Once it's done, you know, it's forgotten. But there's some guys that, you know, it's a milestone that they can't get over. And as
No.
Dr. Pearl said, go on.
Sorry, Peter, can I just come in briefly before the gentleman comes back in? And I know Kenny's waiting too. Just to say, I've had the test done myself, and as I put in the chat, it took less than a minute for it to
That's
be
right.
completed. My own feeling, though, and Dr. Pearl may have a view on this, was more that particular test was more to establish whether there was an enlarged prostate, which, because that, to me, that would have been what the doctor would have been feeling for. Maybe I'm wrong. And of course, having had that test, my doctor thought it was okay, but actually, because of my heritage, agreed with me that actually I should also go and get a blood test, which I subsequently did, and we might pick up on that in due course. But gentleman wanted to come back in, I think.
No, all I wanted to say is, I think it's been talked about too harsh, because I think we as black men, what it is with black men, they don't like nobody invading round that side of their rectile. You understand what I'm saying? Like we as black men, we think that's only, you know, that's a, you know, like they're not gay, or they're not a butty man, so them no want nobody for trouble and bottom. You know what I mean? They're very sensitive on that section there, but I think it's been talked about a bit too harsh. Like it's more how can I put it? It's more invasive than how we talk it. You understand what I'm saying? Because I've never heard no one really talk it exactly what takes place to make a man know, say it ain't, to what I went through anyway. I only can talk about what I went through. It's not really invasive to how we think it is. You know what I mean? I'm just going by what happened with me, because the way I've been heard it's been talked about for years. Oh, I'm not making no man put my finger up my bottom and rear, but it wasn't really like that, really. You know what I mean? Like it wasn't really like that. But you're saying it is like that, but I'm saying it happened that quick that you're not even, you probably won't even know, because it's like as they do it, it's like they just, it's done in a.
I just say, I think what you're saying is absolutely right. It's a very simple test. It's quite quick. You know, I think the fear of it is what puts men off, rather than the actual test that it is, because it's a very small gland that is being felt for, and you know, the examination of the gland is only a part of the whole assessment of, you know, a prostate problem. So it is a quick exam, and just like you said, exactly what you were told is what to do. We ask the patient to get on the, you know, to lie down on the couch, roll up into a ball. You know, it's a quick test. We just have a quick feel of the prostate, see whether there are any any hard areas, whether the gland looks enlarged, whether there are any suspicious feeling areas, and we add that in addition to the blood test, and that helps form, you know, gives, you know, your part of your diagnostic assessment of the prostate. And it's very simple. It wasn't done, you know, what was done was what needed to be done.
Yeah, but all I'm trying to say is, on all the talking webinars I go on, they talk it like it's very, you know, like they I think they make us feel a bit more frightened than how easy it is. They put fear, they put a fear factor.
Yes,
They
it's
put-
absolutely very simple. It's a
they
very
put a-
simple test.
No, but all I'm trying to say is every talk session I've been in, they make it sound more like it's a terrible thing to have done. You know what I mean? But I'm just saying, I've never heard a guy saying, listen, it's a simple thing. It's not, you wouldn't even know it's done. The time you lay down and you call up in a ball, within 20 seconds, you wouldn't even realize that it's all done and dusted already. They've checked within that. Because what I've never heard no one talk about, when you've curled up, they're almost there anyway, because they're near the prostrate anyway, but it's just a little depth into your bottom crease. You understand what I'm saying? Which it ain't really like when you're saying, oh, they go into your bottom, it's like they're gonna shove their whole hand up in your bum and rear and disturb the whole of your inside. But it's not talked in a comfortable way. It's talked in an uncomfortable way, where the black man said, nah man, I don't want none of these things in my bottom. You understand what I'm saying? But it's not as harsh as what you guys make it sound like to be. You understand what I'm saying? And that's what I'm trying to say. I'm trying to say, like, you're saying, oh, it is, but I've actually had it done. I mean, I've had blood checks for the last 5 years. Yeah, and I definitely didn't want the erectile one done. I mean, I was always avoiding it. But then one day I said to myself, you know what? Something don't feel right here. Let me just double check, make sure everything's all right. You know what I'm saying?
Andrew,
so I'm just
Andrew, sorry, I think I've had the same experience. I think there's I think your point is that for future reference, I think people should emphasize the fact that that particular procedure is not as onerous as maybe it has been suggested. But I think there's a few other people who want to come in, and we also want to hear the speakers and get on to the wider Q&A. And I know there's at least one question in the Q&A session waiting. But Peter, I know Kenny wanted to come in next, and I think there's somebody else waiting after that. I think that's who is that? Sean Lewis, I think, after that. So
hello there. This is Kenny. I just want to share something. It's personal, but at the same time, I believe it will encourage the men. And also, I want to touch on some of the further myths that are frightening men. I'm a twin, identical twin. My twin brother lives in America. He's an airline captain there. We have had the issue of enlarged prostate between the two of us. There's no history in the family with either my father or any other sibling, but we've kept a check on it. And eventually, because he has to go through medicals rigorously and so on, he's more conscious about things like that. On one of the occasions he went for a check, I think he decided to have a biopsy done. And it was found out that there were cancer cells. And he didn't even think twice to consent to his prostate gland being removed. And one of the things that I shared with him, because I had to go for biopsy as well, because we're identical twins. One of the things that I shared with him, and I think a lot of men they may not want to talk about it, is, okay, you've had this gland removed. He had an operation. Then I started asking him, so how does it affect your manhood? Do you still have erections? Do you do this? Do you do that? Those are some of the things that men don't want to talk about. If it's caught on time, in his own case, and it's operated upon, he functions normally as a man. He does not ejaculate semen, but he is able to have normal erection and every other thing, and he's back to full health. And I even asked, the last time I went for my biopsy, that's the bit that can be a bit painful, because you have to have an instrument pinch a bit of about 12 pieces of flesh to be examined from your prostate gland. That's a bit painful, not crazy painful. A bit of bleeding comes with that. But within 3 days, 2 days, you're fine. You walk out or get somebody pick you from the examination, but you are fine. I was able to go to work. And when they came out that it was inconclusive, I decided to go for another one, which was fine and which was clear. Every year now, I will go for the biopsy as well, because I've had a very close person go through that. And if anything like that is found, because I know from his own experience, it hasn't affected him at all. We are in our 60s, mid-60s, both of us. Kids are grown, so not having semen or ejaculation during intimacy is not a big deal. I don't plan to have a change of service provider or to downsize or upgrade. I'm happy with my wife. We're all great. I want to stay healthy. I want to live long as much as possible. So I want to encourage all men, do not shy away. If you have to go for a biopsy, which is a step further, I think it's a good thing to do. Thank you.
Did you say you have a biopsy every year?
I have requested to have, I've had 2 last year. I've requested to have another one because my twin brother had the cancer detected early.
Right. I mean, Dr. Pearl could add something to it, but you really don't want to have a biopsy every year.
Well, this
It's
is
quite an
second year.
invasive procedure.
It is quite tough, but because of the experience of my twin brother, like I said, we're identical twins. I don't want to take any chances. But doctor could clarify, do I need it every year? How do I know that, especially when my twin brother has gone through that? I want to be able to catch it too if I'm carrying any cells like that.
So, I mean, thank you for that. And I think, probably, Dr. Kenny, your situation is probably quite unique in the sense that you had what we call your twin brother had a preclinical diagnosis, and you and him share exactly the same genes. Now because you are of the same gene pool, exactly the same gene pool as your identical twin brother, the expectation is that your risks will probably either be equal or mirror each other. However, there will be differences as a result of, socialization and, your environmental factors may differ. And that may then, impact sort of your risks either way. Those are some of the more complex areas that, your oncologist would talk about or discuss with you about what would be the best way forward. And what we do know really is that even when you have a biopsy, it takes, like you said, bits of the prostate, and it doesn't take all of the prostate gland. So you're looking at a small number of cells in the prostate gland. So the ability to pick cancer early, in some ways, is absolutely fantastic. But in terms of having an annual biopsy, you have to probably, be thinking of, not just the possible harms, but also the possible benefits, and whether there may be a less invasive way of getting the same result. So in these days now of MRI scans of the prostate, and it may be that those are the kind of things that you might be thinking of discussing with your oncologist. But what I'm saying is that you're in a unique position. We do know that if, like one of I think somebody alluded to, is if you have the gene. So if you have, I think at the beginning of the consultation, the gentleman who was giving the presentation, if you do have sort of what we call the BRCA gene, so in the female arm of your family, we know that in itself can put the male members of that family at a higher risk. So there are family clusterings or genetic clusterings that will put people at a higher risk, and those people would be, we'd expect them to be under sort of a more close surveillance. But whether how that is done, and what would be the best way forward really would be discussion with an oncologist, and you'd be looking at the risks versus the benefits. And that's definitely something I would suggest you can look at other options as well, and look at all of the options, and what are the pickup rates of the different methods.
Oh, wonderful! Thank you so much. Thank you so much, WACA. I'm Kenny. I used to be co-chair for Nigerians in Watford Association. This is a great program. We should have some more of this. Thank you.
Kenny, I would only suggest that if you're not already a member, that you join. We'll put the link in the chat. Membership is free, so we'll do that. But I think Sean Lewis wanted to come in.
Good evening, everyone.
Hi, Sean.
Yeah, hi there. Great show, great meeting. Very informative. Lots. Got a couple of questions I wanted to ask, or anyone if they would know. I wanted to know basically what would be the, how can I put it? What's the process with regards to knowing if you've got prostate cancer, or would it be a case of getting a checkup every 6 months, or is there like symptoms that you would know? If not, how do I go about, I don't know, getting myself checked so that I've got that peace of mind to know that I have or I haven't got it? Yeah, just a couple of questions in my mind that I'm thinking, you know, like what is the straightforward? I mean, I'm guessing there must be a process that, you know, if you've got
First of all,
something, if you've never had it before, how would you know?
First of all,
For those
Sean,
that
how
haven't had it.
old are you?
I'm 45. I lost my dad to prostate cancer coming up to 3 years ago. But basically, obviously, when you get to a certain age, you're going to get more checkups, you're going to get more blood tests, you're going to know more about what's going on. But with my health history, I've not really needed to go to the doctors all the time, unless obviously something was to happen to me where I felt I had to, you know, go and get myself checked. But my health has been, well, touch wood, I've not had any major scares or any reason to go and get myself checked out. So for somebody who had a good health, you know, I used to play football as well, used to dance, do a lot of walking. What advice would you give to somebody or anybody that would be able to advise me? What would be the best thing to do with regards to the process of prostate cancer and just keeping my peace of mind clear so I know I have or I haven't got it?
So I don't know. I'm a GP, so I can sort of respond to this from a medical point of view. I'm sure the gentleman on the call can talk to you via from a lived experience point of view, and what they experienced and what made them go forward for the testing. And from a medical point of view, when you're talking about signs and symptoms, for a lot of men, there won't be any signs and symptoms. And that's why, in the current climate now, we do have the early cancer diagnosis plan, whereby we're encouraging all Black men over the age of 45 to come forward and go and ask for a blood test, a PSA blood test amongst their routine blood tests. When it comes to health, your general health, we would expect that you've had your blood pressure checked, you have your cholesterol checked, all of your general health checks, just to make sure that you are actually as healthy as you feel you are. And so that would always be, I would say that would be your first point of call. When it comes to signs and symptoms, because that's what you asked, what would you be looking for that would make you think, well, there's something not quite right? And as the gentleman, explained in the talk and in the presentation, is if you think about where your prostate sits, which is just under the bladder, and it does, it becomes problematic when it gets bigger. And so what signs and symptoms would you get? And most men would either find that their urinary flow is not as good, or they have to wait a bit before the pee comes out, or after passing urine it dribbles a bit, or they have to stand a bit longer than they would previously before the flow, before the urine flow comes out. So those are what we call prostatic signs. You might find some men find that they get, they might have urine infections, which they've never had before because the bladder's not emptying so well. They might find that they are getting up, more than once or several times at night to pass urine, which they probably has crept up over time, and they thought, well, I'm getting a bit older. But we say, when you're having some of these urinary symptoms, definitely we'd be thinking, quite significantly about your prostate. So those would be the signs, some of the signs and symptoms that you would have for an early stage. unfortunately, sometimes it doesn't present in some people until it's quite late. And so if you have what we call disseminated prostate, so for example, back pain. So we know that if unfortunately the prostate cancer has spread by the time it's caught, and some people, that's their presentation. That's how we get to know, they've got intractable back pain. Back pain that's just not going away. They've seen the physio, they've done this, they get this localized back pain in one area. And then you check their PSA and it's, in the 20s or the 30s, and, and then you do the checks and then you find out that it's, it's prostate cancer that's been disseminated. So there are, we want to catch it early, but unfortunately for some people it's not. So once you hit 45, and if you've got a family history, you should be having your PSA checked, and you should be having your digital rectal examination. Those are the first main things to go for, whether you have symptoms or not. That would be my suggestion to anybody. And then if you do have symptoms, don't just ignore them. Don't just think, well, I'm getting a bit older, which everybody is. But could it be something more? Can I just get a peace of mind check? And then have it checked. And then now we would invite men to have it done at least once a year. You don't have to have it done 6 monthly. If it's raised, then you'll be seen, or you then go into the cancer monitoring, depending on, you go through the whole system to assess whether it's prostate cancer or whether it's just an enlarged prostate, what we call benign prostatic hyperplasia, whereby we've checked that we can't find any cancer cells, but the prostate is a bit large, and then you have simple testing, you have simple medication that would help the prostate work.
No, hold on.
So I hope that's answered. Answered some of the questions.
Okay, so over to you, Peter. Can I suggest that as we do have a Danny who will be coming in later on, that we now more or less save the questions until Peter is finished, and then you can always make a note in the chat of any questions that arise, and because we'd like to spend the bulk of the time actually having you answer your questions being answered. But let's try and see if we can finish the presentation and then hear from Danny. So Peter, do you want to carry on?
Okay. So as a bit of a summary, so 10,000 men each year, they're diagnosed too late. So these are men that have either ignored the symptoms or they didn't have any symptoms. There isn't a screening program in the UK. This is something you have to be proactive about. Black men were at double the risk. And as we said a number of times, early stage prostate cancer, there's often no symptoms at all. And prostate cancer has a number of areas that you can get support. So I'll have these up later. So there's the risk checker, which I mentioned earlier. There's a weekly newsletter, specialist nurses that you can talk to. There's a very extensive range of guides and handbooks, and there is also extensive information on the webpage. And that's the end of the presentation.
Okay, so I'm actually, as we've already taken some questions, going to suggest now that Danny shares a story, and if people can make a note of any questions, further questions for Peter, or any questions about the subject in the chat. It's easier to do that so you don't forget what you might want to ask. I certainly have that tendency to do that if I don't make a note of it. And then we're going to have plenty of time to pick up on those things. So after Danny has spoken, we'll go back to Dr. Pearl to see if she's got any other thoughts at that point in time before we open up to general questions. And I will also want to just ask Michael, who is here with us from Cancer, to just say a few words. But I'm going to ask Danny now to share his story.
Hello, everyone. My name is Danny McKenzie. I am a multi.
Sorry, Danny. Can we ask Peter to stop?
Oh, sorry.
Peter, do you want to stop sharing? Okay. Okay. All right, Danny.
Right, so Danny McKenzie, I'm a multidiscipline exercise trainer from Watford. Just turn this down. Okay, sorry about that. Okay, so I'm an exercise trainer from Watford. Okay, I'm approaching 60 next month. So I started getting the finger test when I was 40, so probably 20 years ago. Okay, and it was only after seeing something on the BBC that said that black men were more likely to get prostate cancer. So following day, I went to my doctor. She didn't want to do it, but she did it anyway. And so every couple of years after that, I kept on, I went back and got finger tests. Okay, so I missed 2020 because of COVID, couldn't see a doctor. So in 2021, I went again and she said I was fine. Okay. But for some reason I thought, you know what, I'm gonna have a blood test. So, can you send me to the hospital? Blood test. She said that I didn't need it, but I insisted, went for the blood test, and my PSA levels were high. Okay, so 4 weeks later, went back, had another blood test, and again the PSA was high. Now I started to get symptoms probably early 2020, slow flow, getting up at night, not finishing, as you normally would. So again, in my back of my mind, perhaps something was wrong. Okay, so I as I said, had the 2 PSA tests. Then they sent me for an MRI, and there was something there. They found something there. I went for the biopsy, and it was confirmed that I had prostate cancer, and it was encapsulated, so it was caught early. Okay, so probably about 6 weeks later, I had a prostatectomy, and I am, well, I'm told by the surgeon that I'm clear. Okay, as I say, how can I put this? I mean, because I've done a course. I exercise with people who have cancer, so I'm qualified to actually, train them. I've done a course probably 18 months before on working with people with cancer, so I had a lot of knowledge on it. So for me, there was no real fear. Just had to get this done. I was offered surgery, radiotherapy, and brachytherapy, which is where they put some radioactive material near the cancer to try and kill the cells. I just opted to get the prostate removed. Okay. So again, something that was uncomfortable was the biopsy. Okay, as someone's already pointed out. After the operation, yeah, the first few days were very uncomfortable, and then just got better and better. Now, things that just need to sort of realize and take with you is that you have a catheter in for probably 2 weeks while urethra repairs, it repairs itself. And after that's removed, then you've got to there's, you know, it is hard to control your bladder, if you see what I mean. So there's pads that you've got to wear, put stuff on your bed so the bed doesn't get wet. There's all these things that you've got to just take into consideration when you know, when this happens. I think I got away easy compared to other people, because if you're having regular therapy, you're going to have, like, you know, you could have severe burns, if you see what I mean, or sunburn as they call it. And I know other men that have had prostate cancer, and you know, they've had radiotherapy, and you know, it's been very uncomfortable. Anyway, yeah, I'm still here. I was proactive and just got myself tested just through. Just a finger test every 2 years, simply because of just watching something on TV and just knowing that I didn't want that. Okay, so there's me. Does everyone want to ask a question?
Okay, Danny, thank you very much for that. I think what we better do is, because I think there'll be some questions that you all might want to contribute to that has been asked already. Michael, who is with us, do you want to just say a brief word about Cancel Out Cancer and what it's all about?
Good evening, everybody. I'm here to represent something called Cancel Out Cancer. It's a series of, it's a session, approximately an hour, where we give people lots and lots of advice and fact about cancer, starting with what cancer is, what the symptoms of cancer is, what you can do to help to avoid cancer. For example, good diet, not smoking, of course, we all know that one, and things like that. What I concentrate last is the percentages. Everybody's scared of the word cancer, but in most cancers, if you catch it early, you can cure it. And that is the big message we were trying to get across. And we do this these sessions either online or face-to-face. Face-to-face is a little awkward because you're all in Watford and we're based in Hertford, Welling area, but that's beside the point. We can organise it. So I will put my name in and email address in the chat, and if anybody would like to attend one of these sessions, please let me know and we'll fix it up somehow. Thank you very much for listening.
Thank you, Michael. I know Sean has got his hand raised, and we'll come to that in a minute. But can I just ask Dr. Pearl, I know you've responded to some questions already, but did you want to add anything more, not so much about the questions that people have already raised in the chat, but on what has been said so far? What we'll then do is open up for questions, and then we'll try and go through all the questions that people have raised. And please keep them coming in, questions and comments, we'll pick them up. So, Dr. Pearl, did you want to add anything more at this stage?
Yeah, thank you so much. I mean, I think I just want to say thank you so much for all the gentlemen that have come forward, you know, to talk about their very personal experiences. Because I think the more we talk about it, the more we're open and honest about not just how it affects us, but also our fears and our worries. You know, the more we can get, you know, save people from, you know, unnecessary suffering, you know, and get people to get the help and the treatment that they need, that's readily available. So for all of the gentlemen, thank you so much, you know, for opening up, you know, for being honest, for saying, you know, for telling us your stories as it is. I mean, it's, as a clinician, it's really very moving to hear, to hear your story. So thank you so much for that point of view. From a clinician's point of view, and working within the NHS, I mean, I've worked in the NHS for more than 25 years as a GP, and, you know, I think we as within the Black community, so whether that's Black or, so it's Black, it's Asian, we tend to trail most of the our statistics tend to trail those of our white counterparts, and that's something that became really very apparent during COVID. And so there is a national push now to get people, to help get them, get early testing, early diagnosis, and so therefore we can get better outcomes. And what do we what are we sort of expecting when we call better outcomes? So increased life, the longevity, living more healthily, living better quality of life, and then just being more healthy generally. So just like Michael said, most cancers, once they're picked up early, the 5-10 year survival rate is excellent. So most times it won't be your cancer that will kill you if it's picked up early. People will probably die of something else, but not the cancer. But usually, unfortunately, the more advanced the cancer at diagnosis, the worse the prognosis. So that's the more likely that person is to die from their cancer. And at the end of the day, most of the tests the initial screening tests or pickup tests, because there isn't a national prostate cancer screening test. I mean, who knows, that in the next 3, 5, 10 years that may well change, as medicine advances and less invasive tests, and more specific, more sensitive tests are developed. But we don't know, we don't have that yet. But I would just encourage any man, especially once now the national guideline has reduced the age of PSA testing in Black men to 45, or if you've got or if you have a strong family history, that's either a dad or a brother, or that sort of thing. Your first degree relative has had cancer, or if you have any symptoms, don't be hesitant to come forward. Just get it checked. First and foremost, it's usually a simple blood test. From the blood test, you make, then you have your digital rectal examination. It's a very simple test, but those together will help, it just helps, know what you, if that is a problem for you, and then get you on the trajectory of getting the care that you need. So I would just encourage men to just, come forward, don't be hesitant. We're all here as clinicians, and, with all of the cancer support, we're here to help, and sometimes, if one is diagnosed with cancer, I mean, everybody, is terrified of cancer. Don't get me wrong, even as a clinician, we're all terrified of cancer. But, the sooner it's diagnosed, the quicker it's picked, the earlier it's diagnosed, the quicker it's picked up, the quicker the treatment, the better the outcome. And there are a lot of supports. So from Cancer Prostate, from Macmillan, for all of the complexity of cancer care, through your GP and through all of the third sector resources that can help you along that journey. So it's definitely not something that you'd have to face alone. But please, I say just encourage people to come forward, have their test done, and if you're white, at least come forward and have the discussion with your GP. That would be your first point of call. Thank you.
Thank you, Dr. Pearl. I'm going to just say a few words about my own journey around this before I open up to questions. In that must be a couple of years ago, because of all the stories around this, me being a Black man too, I thought, well, I better go and get myself tested out. So I went and got the finger in the bum, which was I was a little bit concerned about, like everybody else, and was very surprised about how quick it was. I mean, did he discover anything over such a short finger up there? Because of my history, he didn't feel anything, but thought, well, actually, my mother's had cancer and other cancer in the family. He actually suggested I would get a PSA test. I got one. We came back, and I think it was in a region around 5 or 6, so I've forgotten the exact figure. So again, he thought, well, actually, it's not so critical at the moment, but let me send you for an MRI scan just in case there's anything more. So I went for one of those, and came back, and the specialist So no, I was referred to a specialist who then sent me for the MRI scan. When I came back from that, they said, well, actually, there isn't anything of concern at the moment, but you should get yourself do another PSA test in 6 months' time. And I've been on that kind of journey. Last time, I was told that actually unless the levels raised to about 8, which is not there yet, then they won't actually ask me to get a biopsy done. So I'm trying to keep to this kind of 6-month regime to get the test result to make sure that everything is going in the right way. One of the things we might want to talk about is how do we try and prevent that? I'm trying to eat less red meat and eat more vegetables. I don't know if it's making any difference, but I'm trying to do my bit to try and prevent me from going down that road. It might be helpful to hear anybody's experience as to what are the kind of preventative measures that you can take to stop yourself from going so far down that road. So that's kind of where I've been, but I know we've had Sean and then Andrew who wanted to come in with questions. Sean?
Hi there. Sorry, excuse me. No, my take on it and the way I look at it is, from what I'm hearing and what I'm listening to, from what I've heard, is that for Black people there is still a stigma there, I find. Not with everyone, obviously. Some are open and happy to talk about it and discuss it and talk about their experiences, but a lot of my friends and associates that I know, when you mention it, they either go quiet or they go silent, or they look at you as to say, well, what do I say? What do I do? And I think a lot of that comes from the unknown, because it's like anything. If you've never been somewhere, or you've never studied a course, or you've never learnt to drive a car, you're not in a position to talk about it. So you remain quiet and you seek the advice and experience. And it's like anything, when you know, you're in a position to discuss and talk and share your experiences. And I feel once we overcome that stigma, it'll be normalized. It will be like anything, like talking about your day at work or your day, it will just become normal. And I think once we get to that stage, then, and people have more experiences and they get checked, maybe, it could be every 6 months or whenever they get the symptoms, or whichever way it works. I mean, I don't know. I'm still trying to work out, do I go every 6 months or do I wait till I find there's a problem and then get something done? I suppose everybody will have their own ways of how they go about it and what they would do if and when. But yeah, I just wanted to add that. And I'm like a sponge. I'm just always willing to learn, and if it can help me and benefit me, and I can live a healthy, free life, regardless of my age, whether I'm in my 40s or that doesn't even come into age, because as we know, anybody can get it at any time, from what I'm hearing. So, with that being said, with that in mind, I feel that these meetings are brilliant, because we're going to learn. We're going to take with us that we can know. Yeah, I did the hour or 2 hours, because now I feel more equipped, whether it'd be the next day or the next week or the next month or whenever. And also, let's not forget, we can pass this knowledge on to for some of us who have children. Okay, if you don't have children, then you may have grandchildren. But so whichever way you want to address it, whichever way you want to look at it, we're going to benefit in many, many ways. So for those that are feeling that there is a stigma, that don't feel shy or worried to open up, because this is life. This is going to be something that we're going to have to deal with every day. So yeah, that's all I really wanted to add.
Thank you,
so,
Sean.
as I said,
It might be
great
helpful.
meeting.
Sorry, Sean. It might be helpful if people, if you're able to put your camera on, particularly when you're speaking. I mean, not compulsory,
Okay.
but it's helpful for us to see each other if we can. But I think you've raised a really good point about stigma. People might want to comment on this because there is, in my view, this wide issue that when it comes to illness, there are some stigma in our community, maybe more so than in some other communities, which isn't helpful. So much to the extent that people don't even want to discuss some of these things with their family members, never mind the wider public. Part of us having this kind of conversation is to try and encourage exactly that people can begin to see that actually it's in all of our interest to begin to talk about these things more. But before I go to Andrew was waiting, did any of our speakers want to sort of say anything more about this? The issue of stigma and talking about this?
Sorry, Clive, you know I talk a lot and I have an
Yes.
opinion about everything, but if anybody else wants to come in, please feel free. But, you know, but if not, I will just say what I do feel about stigma. And that's really because I feel sometimes our culture can act as a real barrier to people, you know, acknowledging problems, seeking help, and coming forward for you know, for treatment and you know, for diagnosis and treatment. And that can be across the board. You know, it doesn't really matter whether it's prostate cancer or even just health in general. And so I'm just going to ask all the gentlemen here, you know, when was the last time you had your blood pressure checked? You know, when was the last time you had your, you know, your cholesterol checked? Do you know your numbers? You know, and for those of you who may have maybe on blood pressure treatment, do you know your numbers? Do you know what your treatment goals are? You know, so sometimes I feel in these days of, you know, medicine where we have what we call chronic health, so long-term health conditions, you know, we can, I think people need to be more empowered and feel more empowered actually to take control for their and responsibility for their health. So as much as the NHS is there to support and, you know, and help keep people healthy, I think as individuals, we do play a real role in taking, you know, taking ownership of our own health and how we approach health. So, you know, some people have said, well, they've never been to a GP. Once you get into your, you know, your mid-40s, your late 40s, you should know your blood pressure. You should know your glucose levels. You should have had a, you know, at least had, you know, had your cholesterol checked, you know, and you should be knowing your, even things like your BMI. Where are you on your BMI chart? You know, because we know that if you are healthy, generally, your long-term health is likely to be better. You know, so it's important that we do take ownership of our health, you know, holistically, you know, making sure that we're exercising when we ought to, you know, we're eating as healthily as we can within, you know, the limits of what we're able. And we know that all of those things will really help an individual's long-term health. So, you know, I have patients who, you know, take blood pressure medicine and say, you know, when did you have your blood pressure checked? They say, well, I take the medicine, it doesn't make any difference, you know. But no, you need to, I think we need to come to a point where we can take ownership of our health and know our numbers. That's one thing. And secondly, I think it's really important that we, you know, I'm African, I'm Nigerian. And so I can see sometimes our health leaders and our beliefs around health and religion can sometimes act as a real barrier for people, you know, to come forward in terms of taking responsibility for their health as well. You know, you think, well, have you had your PSA? You think, well, you know, if it's in my place, they say, you know, God forbid, that's not my portion, you know, but we know that, you know, these things happen and, you know, we don't know who is going to happen to, but they do happen, you know. So by all means, I say people pray, but, you know, as somebody said, science can, you know, science is one of God's tools for helping us. So science didn't come out of nowhere. So even if we believe in God, we know that science was given to help us live better lives. It's, you know, it's knowledge that God has given us. So I say to everybody, make good use of what science has available for us today, because we know it helps. So, you know, by all means, you do all the prayers and all of that, but let that not act as a barrier to, you know, it should run alongside, you know, modern medicine, because those are the tools we have, you know. And of course, your general health, you know, making sure that you're exercising daily, you go for a walk, you know, you're eating healthily, you minimize your salt, you know, so it's just having healthy habits to help us, our general health. And of course, knowing your numbers. I think everybody, as we get older, once you get into your 40s and especially into your 50s, you should know your numbers. You know, I think there's absolutely no excuse. And I'd encourage people, everybody, men and women, to, you know, to come forward and make, you know, go make good use of the health service that's available to us in this country. And so that's
okay. I would summarize that by saying Orbia is not responsible for all of our ills. And probably enough said about that. Thank you very much, Dr. Pearl. Brother Andrew wanted to come back in.
Yeah, give thanks, Sister Pearl. Very, very information you're giving out there. One thing I like to say to our community is a problem we have, right? We're not flushing out our bodies. We're not detoxified our bodies. Our bodies is full with so much chemicals and so much thing with the food and everything. I think where a lot of us has gone wrong, back in the early days, our parents used to give us washouts and detoxify our body. That tradition we forgot about. We're not doing it again. So that's caused only for parasites and worms in our body, what's contributing to all these illnesses here. Yeah. And number two is, when I speak to a lot of men and women and I ask them, what are their blood pressure reading? They always tell me, oh, they don't know, but the doctors know. And I tell them, how can the doctors know? The doctor don't know anything. It's on the system. You got to know. You got to take some accountability for yourself. You know, that's what I find out. A lot of our people, they don't like. My blood pressure machine is right next to me. I check my blood pressure probably just nilly-willy. You know, I just checked it not too long ago. 117 over 79 over 89. You know what I mean? I know that's not too bad. But when I go around and I ask anyone, they say they don't know. Majority of people I ask, they just said to me they don't know. Their doctors know. And I think, no, your doctors don't know, man. And you know, like, these are the things we're forgetting. You know, we got to take accountability. You know, like, I don't eat meat. I don't eat red meat. You know what I mean? I don't eat no meat at all. You know, but you know, like, some people say to me, you don't need to drink a lot of water. You know, like, things like that. You know, people have already got the misconception of that your body does need flushing out. You know what I mean? I think a lot of the problems we suffer with, because we're not detoxifying our bodies, we're not flushing out the bodies, we're not flushing out all the toxin in our bodies, because all the food nowadays, they're carrying a lot of pesticide. You know, they spray the food, they do this with the food hasn't got no nutrients in it no more, so your body is lacks intolerance, it's missing out on a lot of things. And these are the things we're not waking up to. You know, it's not like 20-30 years ago when, you know, there was nutrients in the foods and like zinc and iron and copper our body need to function properly. We're forgetting all of these things. So a lot of us are running into problems, you know, and these are the things what needs to be addressed. You know, we as a community, we need to be accountability for everything what's going on with our bodies, you know, because your bodies is your temple. You know what I mean? It's just like
thanks, Andrew. I think your points are well made. I think you made 2 points there. And I don't know if people want to comment on this. One is about washouts, and the other one is, I alluded to this myself, about diet. Does anyone want to talk about any of those things and whether or not they're having a relevance in the debate about prostate? Dr. Pearl said, since you're the doctor, I don't know if you have a view. I noticed there was somebody else who's a doctor on here. I don't know if I've forgotten what the name is, but have any thoughts on any of those things?
Sorry, I'll just let Uncle Kenny come in. He's just put his hand up, and then I can just, you know, say my thoughts from a medical point of view.
I teach food tech. My specialty is food safety and food control. And I think what people should focus on a lot is to look for those sources of protein that is unsaturated, plant-based protein. Some people like the taste of meat and so on, which is fine. You can have choices in moderation, but more than anything, protein that come from plant sources, plant-based, beans, lentils, nuts, they are healthy. And red meat, not that good at a certain age. Fish, some people like fish, but a lot of emphasis on unsaturated source of protein, and then lots of fruits and vegetables, because a properly balanced diet on a plate every time we eat should have on that plate 40% of that plate should be fruits and vegetables, just to make sure that your immunity and all that is up. You get vitamins and so on. 38% carbohydrates for your energy. You should have on that plate 12% protein, but mainly unsaturated from plant bases. 8% dairy products to make sure that you still keeping your bones strong, your dental structure healthy, and a little bit of fat, oil, and spread for your warmth and to protect your internal organs. Avoiding too much of fat, oils, and spread because of coronary heart disease, which can be, and then of course, as you said, to avoid too much sugar, too much salt, especially because it can lead to things that can bring about stroke and all that. So I think diet is important for us to be aware of the proportions of our plate every time we eat. That's what I wanted to add.
Thank you, Kenny. Dr. Pearl, you wanted to come in? Can I just ask, if you are not speaking, could you put your microphone on mute, please? Dr. Pearl?
Yeah, thank you very much. I just wanted to say, the gentleman was speaking about, detoxification of the body. Now, in medicine, there is a, well, it's not that new, but there's a sort of a newish theory behind, disease, and it's called inflammaging. So it's inflammatory conditions that come along with aging, and part of that is as a result of our lifestyles. We live in when you live in a 24-hour society, the body is designed to have what we call a circadian rhythm. You sleep during the night and you get up during the day. But if you're working, so if you're a night worker, you don't rest at night. All of these things can have impacts on your body's ability to rejuvenate and to renew itself, because the body is really designed to regenerate itself during those times when it's sleeping. And of course, just like what Brother Kenny is saying about making sure that you have a really healthy diet. I tell people to have what we call a rainbow diet. So when you put your food on your plate, you should have a mixture of colors. It shouldn't be all beige. You should, definitely your beige food. So, you have a whole heap of rice and there's nothing green to decorate it, or you have all your potatoes and mash and there are no vegetables, So people need to be thinking really about incorporating foods that have different colors in their diet, but also long-term stress. We know that long-term stress has long-term effects on chronic health. So even a lot of the cancers now, we are thinking, the thoughts are that the environmental factors can be, in some ways attributed to stress and long-term stress. So it's also things like making sure you have a good night's rest, you sleep well, you're mindful about, we can worry from now till we die. There's always something to worry about, whether you're worried, there's always something to worry about. And so that constant worry, what it does, it sets up inflammatory responses within the body that the body really doesn't have time to get a rest from or to rejuvenate from. And so being mindful, or mindfulness, so finding ways to de-stress, and whether that's, having connections with your family, good family and friends, whether that's going out for a walk, being out in nature. We know that some of those simple activities can be really, really helpful in helping reduce stress. And if you reduce stress, you reduce your blood pressure, you reduce your risk of a lot of cancers, including prostate cancer. We can't, it's not yet quantifiable by what numbers it will reduce your cancer, but we know that it does have positive impact. And even for people who do have cancer and have treatment, we do know that there are a number of things that they can do that can help them on that cancer journey. And so it's looking at the body and the mind holistically, and taking good care of individual, of yourself and your individual, and your individual and your general health. So, because I'm a general practitioner and I've been for many years, I see people on the whole journey, of their lives. And we do know that some people are healthier than others, finding connections which are meaningful, going out to exercise or to encourage. And I'm going to ask and encourage all of the gentlemen on the call today, how many times have you gone out for a walk? Or how many times do you go to the gym if gym is your thing? How many times do you go out to play football? Things like that. How many times do you engage in exercise or activity? We come home, if you're still working, you plunk on the sitting room, you watch TV, football is on, the blood pressure goes high, because you're cheering or your team is winning or it's not winning, that sort of thing. And, so what I'm saying is think holistically about how you look after your life. It's really, really important.
Absolutely. Thank you very much. David, you had a question. Then I know Marilyn wants to raise a question, but Marilyn, I'm going to ask you after David to maybe ask your question and maybe also help me by just taking us through the questions and comments that we have in the chat, because we like to make sure that people's questions are always answered when we have these sessions. So, David, I know you put your hand down, but did you actually want to?
Yes, I did. There's a couple of things that I've observed, and then I'll tell you about me. One of the things that I think is making us as Black men more vulnerable to this kind of disease is our machismo. We seem to think that, if somebody invades our body, then it makes us less of a man. And the first thing that people talk about when they're talking about prostate is, oh, I'm not going to have somebody stick the finger up my bum or stuff like that. So I think we have to get rid of that that stigma. It's not necessary. We're trying to get healthy, and if that's the way that we have to go about to check ourselves, then that's the way we get done. So machismo out the window as far as I'm concerned. The second thing I thought about was, the doctor mentioned it as well, about the sedentary lifestyle. Like, for example, I sit down maybe for about 8 hours a day at the desk and I don't move around that much. And I wanted to ask a question which the doctor can answer later, whether sitting down, for example, they say is the new cancer, is like the new smoking. They call it sitting, it's like the new smoking. So I wondered if that would have an effect on the prostate. And then the third thing is that I have blood pressure and I go regular for blood tests and so on, but I always make a point of asking to have a PSA done as well, just in case. I just ask for that to be done. I've had, the finger up the bum and the colonoscopy, whatever you call it. I've had that done as well. And while it is invasive, I know that it's for my health. So I've got no problems with it. And I don't think other people should do, really. I think that's all I wanted to say, really.
Thanks, David. I don't know if, Dr. Pearl, whether you want to say anything about sedentary lifestyle. And then I'll just ask Marilyn to ask a question and then just take us through some of, take us through the questions and comments that we have in the chat.
Okay, yeah, so thank you so much, and I think it's really encouraging to hear, when men are actually taking responsibility and ownership of their health, one is your sedentary lifestyle. And what I did say earlier is, we do know that one of the greatest determinants of longevity is activity or lack of. So the more active people are, the longer and healthier they will live. The less active they are, the less healthy they will be, and the less health, the shorter the lifespan. I mean, there are all sorts of postulations about that. So, like I said, you don't need to do too much, but you just need to do at least the minimum. And then anything after that is bonus. The NHS advises at least half an hour of vigorous exercise 5 times a week. So that can, but we say, if you're going to choose between doing something and doing nothing, do anything. So even if it's getting up and going for a walk. When my husband was, used to go to his previous office, I say, well, go up the stairs. If you have stairs in your office block, during your break, just learn to walk up and down the stairs several times. That will help. If you get on the train or the bus, just park your car, fewer stops away, so you're not sort of parking right at the very front of the shop or the very front of the train station, and do that walk. Make your walks interesting. Go out in the countryside. Most of us live in Hertfordshire. There are lots of parks around here. I mean, believe you me, I'm not a runner, but I went on a park run, and I could count on my hand the number of gentlemen that are Black, of ethnic minority. So what I'm saying, that we need to be thinking more about how we get healthy and how we keep healthy, and that's really important. So it doesn't really matter what you do, but so long as you're doing something, that will be really helpful. And then, of course, it's like you said, most gentlemen, once you're over 50, you should have an annual PSA. The doctor may not request it because it's not within the general framework for your NHS check, but just ask your doctor, can you add in a PSA check? Can you add a PSA check? And then your numbers, so that the cutoff number for your PSA will change with age. And so if your PSA was 2, you're 50, and it's going up to 3 by the time you're 55, it may suggest that things are changing. And so it's easier to have intervention early if it's picked up early. And lastly, sorry, before I forget, I wanted to talk to all of the women on the call and all of the women that will listen to this. Just be mindful of your partners or your husbands. If he's getting up at night, or if he's, if you find out that, he's, every time you go out for a journey now, you have to stop 3 or 4 times, when previously he could, do 4 hours in a car and he wouldn't have to stop for a toilet. Things like that should have alarm bells ringing, thinking, what's happening with my partner or my husband? Does he need to get his PSA checked? Is his prostate changing? And of course, in his general health. So really, it's for men and it's also for women as well. So thank you.
Thank you, Dr. Pearl. Marilyn, I know you had a question, but could you just or a comment, and then if you do what you do so well, just take us through what people have been saying or asking.
Yeah, absolutely. But really, I was just kind of coming in the, kind of conversation beforehand, just to really, in terms of what Dr. Pearl was saying about the importance of stress and mindfulness. Some of you may or may not know, I've been a hypnotherapist for the last 23 years now. So anything to do with mindset. And one of the things I would say, there are a few myths around that as well, that anything to do with mindfulness, meditation, all the rest of it, there are some conflicts with the church I have come across, but also just in terms of the general stigma. People think it has to be very complicated and it has to take a long time and you need loads of time, in silence. And it's like, no, you could relax on your commute on the way into work in rush hour, because that's the only free time I used to have. So I'd always say, even if you just started with focusing on the breath and just doing 30, 60 seconds of just mindful breathing would be a really good start to get the kind of oxygen flowing, and being mindful of the people that you are around and the kind of conversations you engage in. One of the things I would definitely say in terms of being more mindful in terms of what you feed your body, in terms of your thoughts and your words, is what you're saying. Focus on what you want or what you don't want, because many people can create quite a toxic environment in their own system just by what they're saying and what they're thinking. And it makes a massive difference in terms of what we're now really starting to understand as the mind-body connection, and how the two can be very intricately, even down to when somebody always said, oh, they're a pain in the neck, they're a pain in the neck. They're off with neck pain and shoulder pain and back pain. It could just be metaphorical, but in the last 23 years, I've seen it enough times that even before somebody tells me what the ailment is, I go, let me have a guess. And then I'll guess, apparently guessing, and it will be exactly what I thought in terms of particular side of the body, particular location. So I know there's a real connection between those two. So just kind of wanted to say that. And also in terms of the inflammation, this might be a conversation for another day, but I'm very interested to know what the doctors here think. My camera's been off today because I've been sitting, you know, using my blocks and using some lasers to help to, you know, unlock the body and clear inflammation. So I'm really interested, maybe it'll be a question to close with. What are we seeing now in terms of advances in technology, advances in the way that we understand how the body works, and going for a more holistic approach? So that's the comment that I wanted to make. And I will go to the chat. Now, the first one was a comment. Susan has put her hand up. So Susan, I don't know, is it a question you had, or Clive, do you want me to go through the chat?
Let's go back to the chat because we might not get, and Susan will make a note of you wanting to ask a question for later.
Perfect. Right. And so first, I apologize for the bings and bongs. I've got messages coming in. Right. So one was a comment. They said, my partner has a PSA in the high teens, yet they haven't been diagnosed with cancer. It appears his enlarged prostate is benign. So I'm not sure if Dr. Pearl, you maybe, if you have any thoughts, or anyone else wants to come in and maybe just comment on that one first of all.
All right. So yeah, so thank you so much for raising that. So and that's absolute, that is an absolute sort of situation that does occur. So when you have the PSA and you have an enlarged prostate, like I said, those are the initial tests. What then goes on is that you may either be offered a biopsy if numbers are raised, or you may have an MRI, and that can look at the likelihood or the risk of having, you know, or a transrectal uterus ultrasound, and that looks at, you know, the risk, or tries to seek out or assess the risk of prostate cancer in that gland with those numbers. And for some, we do know that, you know, for some people, they will have quite enlarged prostates, but they've done all the checks, may have had a biopsy, or they may have had an MRI scan, or a transrectal ultrasound scan, and there are no signs of prostate cancer. And so what would tend to happen in those cases would be regular monitoring, is one, to see the rate of change of that PSA, and two, to see if there are any changes in symptoms. So yes, we do know that for gentlemen who, a majority of men will have benign prostatic enlargement, and they won't have a cancer, but they may have numbers that are sort of hovering slightly higher than normal. And those men, we would have treatment, would have regular monitoring. And for those, that cohort of men, they should be having regular PSA checks, so whether it's 6 monthly or whether it's yearly, depending on what, you know, the urologists have advised, just to keep an eye on that prostate. So yes, it definitely does happen. And then normally, as a primary care physician, the urologist would then advise us, you know, if your numbers get to, you know, for different people, different ages, different risk factors, it might be 15, it might be 10, it might be 20, then we would refer them back for further assessment. So, you know, medicine is not set in stone, and, you know, and it is fluid. And so really you have to understand what the risks are, you know, for each individual person, and what your risk is for you, and what those numbers mean for you as an individual. So that would be my response to that.
That is absolutely wonderful. Thank you very much. We also had, it was more of a comment than a question, this one first, but it was Taylor. For those of you who have not been looking in the chat, do, because there are some links in there. So this was from Taylor. Prostate Cancer UK. So of course, thanking our wonderful speakers, but she's also added a link where you can find the risk checker. So that will be very, very useful. As Clive has said, if you wanted to be notified when the recording goes up, then just leave your email address. And I can see some of you are doing that. Now, now David may have already touched on this, but David said, I find myself getting up a few times during the night. Do you think it is worth me getting my prostate checked? I know my answer to that, but Dr. Pearl.
So I would ask David, what does he think he ought to do now, having heard all of the stories and had all of this information? So I think I know what I would suggest. I know I would advise. I'd like him to think, not just what he would like to do, but what are his concerns and what are his fears? Because that's really why he's asking that question. What is he worried about? And how best can he get that addressed? And so if you're worried about prostate cancer, which is really what most men would worry about, is then have a think about, is your family risk high? Have you had friends who've had prostate cancer? Do you know somebody in your circle, your life circle, who's had prostate cancer? And I think those are the barriers, and it just, really think about not just what you need to do, but how you will get it done. Because I think that's really that question you're asking. And a simple answer would be yes. But but it's also looking at the barriers. What are you worried about? And then before I let go, I say if you go for your GP's consultation, we know that GP's time is very short. You may or may not get a face-to-face, at least not for the first consultation in this day of telemedicine. But it would be really good to write down your questions. Or have an idea of what are the questions you want to ask, because then it's much easier to have a conversation that will meet your needs, and have that consultation that's going to answer those questions and those fears that are actually at the back of your mind. And don't be afraid. No question is silly. No question has not been heard of. And if the doctor doesn't have an answer, they can find it out or refer you to somebody who can. So please, just make good use of your GP consultation to help you get your get the care you need. That would be my answer. Thank you.
No, wonderful. Thank you. And this one is a comment. There is a question at the end of it. So it says, men innately carry an irrational fear of most things medical, and says, note the difference in focus on women's health versus men's health in society. There is a government policy in support of women's health, looking at things like the menopause, for example, but none in place currently. What can we do to bring forward more focus on men's health? And with an election around the corner, what can we do to bring prostate health up on the agenda? So I don't know if any of our speakers who have presented, for example, who have actually been through the system, you've seen it from the inside out, would love to perhaps hear your thoughts on what might happen. I'm guessing with what's happened with Prince Charles, although it was not prostate cancer, Buckingham Palace have gone to great pains to say it was not prostate. I'm guessing that rises things up the agenda a bit, because we've already seen the newspaper headlines, but very interested to know if there are anyone else who would like to comment on that one.
So I've just waited a little bit to see if somebody has the courage to come in. And I'm just going to say, and this is my personal experience as a GP working in Hertfordshire, is that we were trying to do a campaign for prostate health, and for Black men. And I said, our men, so Black men in general, hide in plain sight. Our men generally hide in plain sight. Where do you go to get them? They can be the most difficult group of people to hunt down. And so we did a campaign where the only place we could really think of to get the gentlemen were in the barber's shops. But if it's women, they go to church or they go to the gym, or get what I mean, or they congregate on something or the other. But our gentlemen, you guys are master hiders. I don't know where you hide, but you are so difficult to find. And it's even platforms like this. You have your, I don't know. So gentlemen, please, where do you hide and how do we find you? Because that has been a real challenge for us as clinicians to think, where do we go to get Black men? So it's probably somebody can answer that for me.
Oh, wonderful. Also, before we answer that, Peter Ellis, is there anything else you wanted to add in terms of moving this up the agenda, and also those of you with your lived experience? And then, of course, we'd love to hear where you are hiding.
Well, the reason, or should I say, when I was first diagnosed, I went through the whole, I'm not telling anyone, this is my business. I didn't even want family to know, and that through all the talks that I do, that is what men do. It's not something we want to talk about. It's for a number of reasons. It could be cultural, it could be embarrassment. Sometimes I've had talks, and I've
Right.
when I
You're gonna eat again, or you're okay now?
when I spoke to somebody at work, and he said, I've got 7 brothers, I'm going to tell my brothers. And he told the first brother, and then he told the second brother, and the brother stopped him 2 minutes into the conversation and said, not only have I got prostate cancer, I'm actually having an operation next week. So even brothers won't talk to each other. And then I just decided to do a complete 360. And I talk about it. I'm very blunt about it. I'm very, very open about it. And it's you can never underestimate how much ignorance there is out there. There's this myth that guys don't want to talk. Guys will talk to the cows come home and give us the chance. It's just not something that it's just something that we just don't do enough of. But it's one of these things that you just have to keep chipping away at. Like I said, there is a lot of ignorance out there. I've spoken to one guy I spoke to. It was a church guy, and he looked me in the face and he said, I don't believe that thing there. I believe if you think about it, the devil will give it to you. That's the sort of nonsense you got to live with. I've seen the videos where people are saying molasses and bicarbonate of soda will cure you of prostate cancer. The videos where another guy who's a master herbalist who said the reason why guys get prostate cancer is because they squat on the toilet instead of standing up. So much rubbish out there. And you just have to keep chipping away. It's not going to happen overnight. There's some guys you would just never get through to. For example, going back to the digital rectal examination, regardless of how quick it is, how painless it is, you are just not going to get through to some guys. And you know what? What I learned is that it's not worth spending energy on those guys. There's other guys out there that are responsive, and talk to those. Talk to women. Women are very good at talking to their partners, badgering their partners, or I did a talk and one woman said, look, I didn't tell him to go and make an appointment. I made it for him and took him down there, and talk to the youth. The youth get it as well. They don't want to see their dads and their uncles and their cousins go through this, and they get it. And they get it straight away. So it's something that you just have to keep chipping away at.
Marlon, I'm just conscious. I can't believe it's gone 7:45 already. And I can see 3 hands up, but I know we still have some things in the chat. Can we just run through those quickly? So ideally, we can try and finish by 8.
Yeah, so the next one is the impact on sex life and how do you mitigate any adverse impact? So I don't know if it's Peter, someone who's had a lived experience, or Dr. Pearl, who would like to take that particular question about any adverse impact? Because so far people have said there might be the initial pain, let's say from the biopsy for 2 or 3 days, but anything else? Peter, I see you've unmuted.
This is one of the things there is a massive impact. There is, everybody's different, but I get why it's not talked about. It's not something that comes up, when you start the journey, but there is a massive impact. And again, it's one of these things that guys won't talk about, and that's why I said I was going to do the opposite. When I started my journey, I could find lots of guys that would say, "Yeah, I had prostate cancer, and 4 years later, oh, I'm all right now. Okay, but what happened in the what was the bit in between? Don't sugarcoat it. Tell me. I mean, one guy said to me, I had the operation, and you know what? My sex life is great now, no problem. But it's not as simple as that. There is that bit in the middle that either they want to forget or they've glossed over, but it's there. And being honest about it is I find that there's just no other way to be. It's you have to be honest, and it's all about getting in there early. The earlier you treat this thing, the better the outcome.
Wonderful, thank you very much. And also the another one, this might be you, Dr. Pearl, maybe to kick us off. What's the commonest cause of prostate cancer, and does the use of sex enhancers facilitate onset of prostate cancer? So commonest causes that you have found.
So like we said right at the beginning of the talk, that we don't know what actually causes cancer. It is higher in groups of people. So I mean, first of all, you have to be a man. If you're, the older you get, the higher the risk. If you're a black, from the black and ethnic minority, we know you're at a higher risk. So when it comes to if you do this, will it cause that? We don't know exactly. I think that our first presenter talks about some of the pets, in some small groups where they were exposed to different types of pesticides. But those are few and far between. So we don't know exactly what causes it, but we do know that there are some what we call risk factors for cancer. And does the use of sex enhancers facilitate the onset of prostate cancer? There haven't been any, no studies to the best of my knowledge have related the two. We do know that, and I thank you for Peter for talking about sex after prostate cancer. We know that sexual intimacy can be a problem. I do a lot of work around menopause as well, and we know that even for women who are at the same age as your gentleman who's having prostate cancer, sex can also be a problem there. But ultimately, there are things that can help. So things like things as simple as your Viagra or your Cialis or Tadalafil may help. Might not help completely, but there are things that can help. There are particular tools that can be used to help erection, and I'm talking about this very openly because I'm a medical professional, and this is important to men. So so there are things that can help. And like we say, each person is different. So what I'm saying is that if that is part of your cancer journey, please talk to your cancer nurse specialist about it. Talk to your your GP about it. Talk to your oncologist about it, and most importantly, talk to your partner, because at the end of the day, she'd rather have a whole man. She'd have her husband or her partner there. Then that's more important to her than just the sex. And I've talked to a lot of women who drag their husbands to come to come and have their PSA. They want the man. They'd rather have the man and not the sex than have sex and not the man. So please, that's the most important thing. So just talk to your partner, because she's the one for whom your presence is vital. She wants you. So so I hope that's answered.
Oh, thank you so much, Dr. Pearl. That is absolutely wonderful. Next, we're going to come to Susan. I've also been warned that I may be dragged off to the tower. I said Prince Charles, and of course it is King Charles. So thank you, Michael, for the reminder and just kind of the warning noted. Now, Susan, we're going to come to you next. Thank you so much for being patient. You were saying in the chat that you're a specialist nurse working with Prostate Cancer UK, and you'd like to share some of the work that you've been doing to raise awareness in our Black communities. So, Susan, over to you.
Yeah, so good evening, everybody. It's absolutely fantastic to see this event being put on and to see the appetite for wanting to understand more. And I just really wanted to briefly say that there's so much I could say, but I'm not going to. It's fantastic to hear from Dr. Pearl and the other speakers this evening. Couple of points which I think are really important. One thing we've not really touched on is about weight. It's important to try and be a healthy weight, because we know that men who are obese are more likely to be diagnosed with prostate cancer that is already spread or faster growing. So that's a very important point, in addition to also having a healthy diet. So what is good for the heart is also good for the prostate in terms of diet. And I just wanted to raise a very important point in relation to when a man is worried about their risk of prostate cancer. It's really important that when they see their GP, that they are under the impression that only a rectal examination is required. The PSA blood test is far more accurate at looking for prostate cancer than a rectal examination. So most men will have a normal feeling prostate, even if they have prostate cancer. But we do hear from men who are unfortunately being told only to have a rectal examination, and the PSA is not being mentioned. Very important point. So we're part funding a very important trial. So as Dr. Pearl said, we don't fully understand why Black men are at double the increased risk of other ethnicities. So this trial is specifically for Black men who are not diagnosed with prostate cancer between the ages of 40 and 69. It is called the Profile Trial, and the researchers are based in London. And what opportunity does it offer for those men? It means that for a minimum of 5 years, it means that they'll be much more closely monitored than they would be if they were seeing their GP alone. So they're studying the genes, they're not changing the genes, it doesn't have an effect on the individual simply by looking at the blood, but men will be having scans that they wouldn't normally be able to access if they're just seeing their GP. It's called the Profile Trial. I can put the details in the chat. So ages 40 to 69 for any men that have Black parents, and all for grandparents that are also Black. If we don't have the understanding, we're not going to be able to advance things. And I'm aware of time, but I'm just going to say finally that the risk checker is there, which is our online 30-second risk checker. Anybody is welcome to look at the information on the prostatecanceruk.org website. Fantastic, well-written information. And also call the service that I work for. So the service is free for mobiles and landlines. And we're happy to speak to any man or any individual who's concerned. Yes, I can put the details down to you. You can look on the Prostate Cancer UK website, just put in profile and you'll be able to see the details. I know the actual researchers, they're fantastic, very friendly. You have a non-obligatory chat in the first instance. So I'll put the details quickly because I'm aware other people want to speak. But as I say, and Prostate Cancer UK overall, we're working at parliamentary level. We're seeing what we can do to drive change. We're educating healthcare professionals, because the last thing we want is for Black men to go to their GP and ask for the test and be declined. So a lot of our work is to support individuals in going back and asking and explaining, in motivating them to not take no for an answer and to reach their goal. At the end of the day, we need to reduce the harm that this disease is causing, especially to our Black communities. Thank you.
Oh, wonderful. Thank you so much, Susan. And yes, for those of you who have been in the chat, you'll see lots of links there. Susan will put that in. And we've got the wonderful Gemma here, who is responsible for sending out those brilliant newsletters and doing the fabulous posters. And so Gemma, for those of you who have put your email addresses in, will collect those and add you to the list so that you receive the updates and the links, etc. And actually, Susan reminded me of something in terms of pushing up the parliamentary scale. One of the things you could, of course, do is write to your MP. And as a local councillor, you could write to your local councillor as well and ask if they can put it on the agenda, because there are things that can be tabled at either full council meeting or at the individual party level. So Keith, we're coming to you for the final question. So Keith, and the time is short, we're racing against the clock. So Keith, over to you, and thank you for your patience, and thank you again, Susan.
Well, thank you. I want to first of all thank Clive, my good friend, for organizing this program. And I came on a little late because I was out doing something, but I listened to, I heard when I came on, Danny was speaking, and of course, Dr. Pearl spoke a number of times, and then I heard Peter. I had a journey, I mean, I have got a journey too, because I'm not unwilling to talk about it, because when I was in my 50s, my doctor used to send me for the annual blood tests and so forth. And nothing happened until when I was about 60. My PSA went up to over 4. Not much was done. I had a MRI scan, but not much was offered to me. It was just 4 point something. So I then asked for another test when about 2 or 3 years after, and that's the key point there. I think you have to be proactive. You can't just rely on being asked to do it. You have to ask for it yourself. And so the next time I ask, and I think I'm learning too from the conversation here, mine was over 8, so it went back from 4 point something to over 8 after 2 or 3 years. And that's where, listening to Clive, I understand it better now, that they don't do anything until maybe it's about at that level. So it was at that level. Then I had a number of other tests, MRI, biopsy, and so forth, etc. And then I was told that I do have prostate cancer. I wasn't offered operation or so, but I was put on a treatment. And I'm now 74. When he first raised his head, I was 60. And so I really want to be thankful that I have been able to be around for so long and still very active. I think that's part of the journey too. You have to be active and not to think that that's the end of the world. If not, if you think it's the end of the world, indeed it will become a self-fulfilling prophecy and the end of the world. So I think being proactive, number one, get your PSA test, etc., and be positive are tools for making sure that you can live a normal life. I believe I'm living quite a normal life after age 60 when he first raised his head, and I'm now 74.
Oh, well, Keith, that is absolutely wonderful. Thank you so much for sharing your story. What a positive note to end on. As everyone can see, there is lots of light at the end of the tunnel. So I'm going to hand back to Clive now just to close the proceedings. But I just want to say a personal thank you to every single person who was here today, our wonderful speakers, people sharing their testimony, those of you in the audience. We've had a very full, vibrant chat in the audience, lots of people wanting to get further information. So Clive, over to you. And thank you also, Clive, for organising these wonderful events, because without you being at the centre of the hub and getting all the speakers and chivying everyone along and getting people on board, a lot of this wouldn't happen. So Clive Saunders, back to you, and thank you, everyone.
Thank you, Marilyn. Before I say a final thank you, as people know, it's just fair to ask our speakers if they want to make any final comments before we formally close. So Peter, you still with us? And Danny? And we'll end with Dr. Pearl. Did either one of you want to say any final words?
Just as simple as just go and get tested.
Okay.
And if you want to read about my experience, I've put the blog details in the chat.
Okay, thank you very much. Danny, are you still with us?
Yeah, I'm still here. Yeah.
And a final word from you?
It's the same. Look, just be proactive. Go and get yourself checked out. You know what I mean? Don't be frightened. You just have to get it done.
Final, Dr. Pearl?
I think I'm absolutely the same. I say know your numbers. So I'm a GP, so you should know your PSA, know your cholesterol, know your blood pressure, know your BMI, know your numbers, and get yourself tested regularly. That would be mine. Thank you.
Thank you very much. Brother Andrew, it seemed like you're desperate to say something. So have you got a brief final word you want to make?
Yeah, just a quick one. Thank you very much for your whole team there. Very interesting. Thank you very much. What I was going to say to you, is there any way a person, because sometimes, the doctors now, they're not too, they're not like they used to be. Is there any other places people can get tested away from going to their doctors?
Is there a quick answer to that, Dr. Pearl?
Sorry. Yes, I mean you can have a private PSA test, absolutely, but that's a cost that you would have to bear. But if that's really something that you want to do, but like I said, there is a drive going now, which is a cancer initiative, and particularly for Black men, and particularly around prostate cancer. So, just please reach out to your GP. I mean, you can do an online consultation and just say, I would like to have a PSA. You might say, well, these are my reasons, or I'm worried about this. But, there are ways by which you can access that information that you shouldn't have to pay for. So please, make use of all of the tools available for you in primary care. But if you want to go privately, yes, you can, but that's a cost.
Thanks very much. I don't know whether the profile trial that Susan has mentioned might be relevant to that. However, we're going to conclude. I'm sorry that we're going over. Well, actually, I'm not sorry, because actually I cannot believe the time has gone so quickly. But some quick thank you. Thank you, Peter, Danny, Michael from Council UK, Dr. Pearl, as always. You deliver every time. Just to a big thank you to we didn't do this all by ourselves. We wanted to do it, and Sharon from WBC, they wanted to do it too, and together we've delivered. We've only delivered though because of the support and the work of others, including our planning group, and Marilyn has mentioned the invaluable work that Gemma does for us. But actually tonight has really been made by yourselves. Actually, it's always about the contribution that people make in this kind of setting that makes the occasion. We've already put in the chat about the fact that Watford African Caribbean Association is a membership organization. The link is in there. If you live in the area, then please join. Membership is free, and our motto is together we can achieve. The recording will be available. In fact, I'll stop recording. The recording will be available in.
Clive, don't stop the recording yet.
The recording will be available if anyone actually wants. So if you've not put your name in the chat, your email address in the chat, then please do, and we'll take it from there. As I say, a great big thank you to all of you, particularly our speakers, and have a great evening tonight.
Clive,
oh, sorry,
Clive,
one final thing. One final thing
might...
before you come in. Sorry. We are also really interested in hearing your thoughts about other things that we should do. So if there's anything that you think that we should do, because we are about you, then please put it in the chat. Marilyn.
Yes, so just to say in closing, as Clive has said, he's mentioned several, but I just wanted to do an official closing because this was a joint initiative. So it's a joint initiative with Watford Borough Council, Prostate Cancer UK, NHS GP, and also Three Rivers District Council. So we just want to say a really big thank you to them as well in terms of the support that they have lent in terms of helping this be a massive success. So that was it, Clive. Just wanted to make sure we mention our official supporters on this one. Thank you.
Absolutely. Thank you very much. Let me just stop the recording.